Hi, I'm Brenda Weiss.
And I'm Anna Welland, and we will be doing the cardiovascular system.
Let's start with the outside of the heart. The apex is the tip of the heart. The layers are the epi, which is the outside, the myo, which is the muscular, and the endo, which is the lining, inner. The auricles are both the left and the right. The intraventricular septum is this in the middle. Next, we will go through the blood flow of the heart.
So deoxygenated blood comes through the right atrium via the inferior and superior vena cava. Once it's in the right atrium, it goes through the tricuspid valve, then into the right ventricle, to the pulmonary valve, the pulmonary trunk, the pulmonary artery, which then goes into the lungs. When the deoxygenated blood reaches the capillaries in the lungs, carbon dioxide is exchanged for oxygen. When that is complete, the oxygenated blood goes through the pulmonary veins into the left atrium. From the left atrium through the mitral valve or the bicuspid valve, then into the right ventricle. Once it's in the right ventricle, it goes up the aortic valve to the aorta and then to the body. Next is the conduction system.
For the conduction system, the signal starts at the SA node, which is often called the pacemaker because it sets the heartbeat. Next, the signal goes to the AV node, the bundle of His, the bundle branches, and ending at the Purkinje fibers.
So for the heart muscles to contract, they need to receive oxygen to stay alive. And so they receive that via the coronary arteries. There are both the left and the right coronary arteries. For the left coronary arteries, they branch off into the anterior descending and the posterior descending, and also the circumflex. And the great cardiac vein is in the front. Then the right coronary arteries branch off into the marginal. On the posterior side of the heart, all of the deoxygenated blood from the coronary veins go into the coronary sinus, and that gets dumped into the right atrium, and for the process to repeat.
Next, we are going over an EKG. The P wave is the depolarization of the atrial fibers. The QRS is depolarization of ventricular fibers, and the T wave signals repolarization of ventricular fibers.